Hello all, this is Dr. Kanan Jhaveri, consultant OBGYN, obstetrician and gynecologist and mom to two kids. Welcome back to my channel, and today I'll be discussing about vaginal infections or white discharge per vagina and so on. It is so common, right? White discharge per vagina. Everyone faces it at some time in their life. And let me tell you, if I ask a leading question to everyone that comes to my clinic, like, ma'am, do you get vaginal discharge? I think 70% would say yes, because literally everyone gets vaginal discharge. So it's important to understand what is normal vaginal discharge and what is abnormal, what is pathological, when to get treated, when to not get treated, and how to take care of vaginal discharge. So let's start with what constitutes the vaginal discharge. Our vagina is a self cleansing organ. It's a beautiful organ. Nature takes care of its own. There are plenty of bacteria living in a symbiotic relationship over there, which produces a variety of substances like lactic acid and hydrogen peroxide, various other organic acids, which maintains an acidic pH over there and prevent the growth of harmful bacteria. That's how it prevents infections naturally. So this substances produced by this kind of bacteria, good bacteria, along with the mucus secreted by our glands inside the vagina and the cervix, they constitute the normal vaginal discharge. Now, if you have seen the consistency of this discharge, is different during the different periods of our menstrual cycle. It differs in quantity, it differs in consistency, it differs in color. For example, during the ovulation time, you might have experienced that the discharge is a little profuse and it is very sticky but watery and very thin and transparent. And as the days progress, it will gradually become a little thick and whitish and a little scanty, and then it will decrease and you will get your periods. So it varies like this under the influence of the different hormones secreted during our entire menstrual cycles. Now, when do we say that this discharge is pathological? So first thing is appearance. If the discharge is frothy, it is thick, very thick, curdy white, or it is greenish or yellowish, like purulent pus like, or if it is frothy or grayish or pinkish, then we can say it is pathological. If the smell is very fishy or it is very foul smelling, then it can be pathological. If you're experiencing itching or burning or pain when you go to pee, or pain during sex, or any kind of pain around there, then it can be pathological. Even if the discharge is very, very profuse, like you have to put a panty liner or a pad down there, then also it can be pathological. So these are the ways to know that you are suffering from a vaginal infection, and if so, please do consult your gynec and get treated. Even if you are not sure, a visit wouldn't harm you. Okay, so now let me make you understand how to routinely take care of your vagina. As I said, vagina is a self-cleansing organ. You don't need to do anything extra for that. But yes, hygiene is important. Washing twice a day routinely when you take shower, that much is enough. Do not put all your fingers inside. Do not use Dettol. Do not use like warm water or anything to clean it. If you want some extra freshness or nice scent from there, then you can use those special vaginal shampoos that are available. So when you buy these products, do not forget to read pH 3.5 when you buy them from the market, because this pH is really important from vaginal hygiene. All the other products or body shampoos or body soaps that we use have a slightly higher pH than 3.5. So do not use them. Another thing, eat plenty of probiotics like curd or buttermilk, dahi chash, etc. Next thing, what are the risk factors for getting vaginal infections? First and foremost, multiple sexual partners, then oral sex, vaginal douching. Another thing, if you have taken a prolonged course of antibiotics, which will actually degrade all the bacteria, the good bacteria that are living down there, then you can get the infection. Next, if you are having low immunity, the causes can be many. For example, vitamin D deficiency, then diabetes, or if you are having infections like HIV, then you are at higher risk of getting vaginal infections too. So, having said all this, let me finish by saying one small thing, a side thing. Have you noticed that your panties are they appear bleached after a while from the central part? They lose their color. So why so? As I said, that the bacteria living there secrete lactic acid and various other organic acids which maintain an acidic pH. So this secretions, acidic secretions, they actually break down the dyes in your fabric of the underwear, and hence after a few washes, after some time, they will appear bleached. So that is normal. If you are seeing that your panties are bleaching, that doesn't mean that you are having a vaginal infection. Okay, so hope you find this video useful, and do not forget to like, share and subscribe. Thank you so much.